Hello and welcome to the program. I'm your host, Neal Howard, on this Health Supplier Segment here on Health Professional Radio. Thank you so much for joining us today. Our guest in studio is Dr. Drouin. He's CEO and founder of San Francisco-based startup Clarify Health. He's here to talk about helping healthcare providers to create a 21st century patient experience. Welcome to Health Professional Radio, Dr. Drouin.
Thank you. Pleasure to be with you.
I'm glad that you could join us today. If you could give our listeners a bit of background about yourself.
After college, I wasn't pre-med during college, but I had the good fortune of going to work in South Africa with the Mandela government to help them figure out how to bring electricity to the townships. And I realized in that moment that I didn't want to be a lawyer after all, and that really I wanted to be in and around issues that would help society, and healthcare seemed to be something that wasn't about to go away.
You have founded or co-founder of the startup called Clarify Health. Being involved in providing electricity to a country, you must have a lot of experience in workflow. In healthcare, the workflow varies so much, and it is quite intense. Do you think that the workflow management is adequate as far as healthcare is concerned?
So that's one of the big things that led me to not go on to practice and instead decide to go down the management track in healthcare. Is to begin with, any health journey is complex to start, simply because biology, throws quite a few unexpected wrenches as people go through their workflow, so to speak. But what's been somewhat disappointing and shocking is, and very much creates the opportunity that we all look at today in creating a 21st century patient experience, is that if you look at what's available outside of health, whether that be in the hospitality sector, in hotels, or in retail, or even sending packages across the country with UPS or FedEx, the level of service and the seamlessness of the experience is miles away from what we have in healthcare. And we have the firm conviction that the conditions now exist to create that same kind of experience that we're used to in other contexts and bring that into healthcare.
In your experience and in your opinion, why do you think that there is this lack in healthcare as opposed to the other industries that you mentioned when it comes to quality of service?
So interestingly, healthcare and perhaps education are two sectors that, for very good reason and understandable reasons, have not been structured as normal markets. And so the customer is usually not, or the patient in this case, is usually not actively spending mostly their own money in making decisions about what care to get. And that introduced a way of paying for healthcare where the decision on purchasing the services, if you will, was dissociated from who was ultimately paying. So in healthcare, most of the country, it's employers that pay for health, or for over 65s, it's Medicare, and then Medicaid picks up, another set of folks. But as a result of it, hospital management, provider management never really faced the same pressures that, say, the leadership of FedEx or Amazon or, Motel 6 face in having to deliver an experience that means that people will want to purchase what they're offering. That's all changing, in part because the government is coming out with new ways to pay for things, and it's creating more managerial discipline. And so as a result of it, the providers are turning around now and they're saying, okay, if we want to be successful and compete, we need to up our game. So that's one aspect. The other important aspect is that patients and their family members are starting to demand it. And that may be, by the way, the stronger force here.
So now that we're as consumers, we're demanding better care, better service. part of this, as you say, that this 21st century service experience is making it so that we want the service that you're offering and at the same time not feeling that we have to demand it? Is that where you're trying to get us so that we don't have to demand it, that it's expected?
Spot on. If you think about going through a healthcare journey such as a hip or a knee replacement, or from I was just diagnosed with cancer to I'm now in remission, that process, which has a multiplicity of interventions and means that you and your loved ones have to take days off work, et cetera, there's a lot of waiting in waiting rooms, is not only anxiety producing, it's today incredibly frustrating, but we accept it because it's the way it is and we always have. And it turns out that we now have all the tools at our disposal to take a lot of that workflow and process waste and the inefficiencies that cause the aggravation that we impose on patients, and instead be able to, guide and pilot patients and their loved ones through a much more seamless and, delightful might be too high a bar to aim for at the moment, but at least a journey that has a higher degree of dignity and a minimum amount of hassle. And a couple of very specific ways in which one can do that. So, for example, why is it that we don't today, when someone is diagnosed with something, immediately give them an end-to-end roadmap of their journey? That's perfectly possible to do instead of saying, hey, as the physician, I'm only going to give you the next couple of steps on a prescription pad, and then you're going to have to go and search the internet and go to some forums to learn from others what you're likely to go through. That's just a very small example, but it's, the act of just prescribing as a physician, not just drugs, but also the map to guide you, and then perhaps the app that can then allow you to communicate back and forth with the care team, so that a bit like when you turn on your driving directions when you're on the road, you'd have the same thing guiding you through that previously anxiety-producing, a journey that was not revealed to you, where now you have some greater clarity on what's going to go on.
How does Clarify Health cut through all of these barriers that you've mentioned that have been in place for generations? How does Clarify Health cut through this and basically orchestrate the care team, the patients, the caregivers, and everyone on the same page to the ultimate benefit of the patient?
2 or 3 things that are critical. One is you have to be able to bring together the sets of data that allow the creation of a real-time movie, if you will, of the patient's journey through an episode of care. And that's now possible to do. It's possible to link clinical with claims with patient-reported data as you're either gathering data from their wearables or the surveys that they can fill out from their phone, letting you know how they're doing. So that's one big piece of it, is knowing what is going on with a patient. And the analogy here is the same as FedEx knowing, because they put a tag on your package, where your package is in its journey from San Francisco to New York. So that's number one. Number 2 is you have to engage physicians in being willing to work in a different way. And here a lot of people say that physicians are resistant to change. What I would say is physicians want to be sure that the change they make will do 2 things. It will improve the lot of their patients, and it will not create additional work or aggravation for them. And in this case, technology can create a double win. So that's a very important part of this. And then the other is you find a couple of innovators or forward thinkers who put it into practice. And because there's new payment models in place where if you do things well, you will get some bonuses, they start speaking about it, and then everybody starts coming in and saying, well, could I do the same thing they just did? Those would be, three of the ways to, as you say, cut through what has typically been a very tough market in which to innovate, because it's well known that it typically takes 17 to 20 years for proven innovations to scale themselves across the health system.
Now, where can our listeners get more information online about Clarify Health?
Absolutely, sure. So it's www.clarifyhealth.com, and you'll find lots of information on the site about what it is we do to help patients, and also to convince physicians to be in on the game of helping their patients to have a much more Amazon or Disney-like healthcare experience rather than, what we've all accepted in the past.
So basically coupling an improved bedside manner with technology and guidance.
Beautifully said.
Well, I'm glad that you could talk with us today.
Thank you very much.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Drouin. He's CEO and co-founder of Clarify Health, and he's been talking about helping healthcare providers to create what he terms a 21st century patient experience. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.